I'm Dr. Ken Landau. Thanks for watching. Let's talk about Namzaric. Namzaric is a pill for moderate to severe Alzheimer's disease that was originally approved by the Food and Drug Administration in 2014, but the medicines, the memantine extended release and the donepezil extended release, had been on the market for quite some time prior to being put in one pill as Namzaric. The donepezil, or Aricept, that boosts levels of acetylcholine thought to be important in memory and nerve transmission. And the memantine is a drug that antagonizes the receptor for NMDA in the brain. Now, even though the pill is meant for people who have moderate to severe Alzheimer's disease, the company says, and I quote, on their website, there is no evidence that Namzaric prevents or slows the underlying disease process in Alzheimer's disease. So you take the drug to help with the disease, but the drug, according to the company, isn't going to help the disease. Well, actually, there were no specific studies of the combination medicine in a single pill that led up to its approval. It was originally meant for people who were already taking both of the pills as individual ingredients, and just as a simple thing, instead of having to take 2 doses a day, you could only take 1 dose a day. And then later on it was approved for people who were taking just the donepezil or the Aricept. They needed a little bit of the Namenda or the memantine, they could take the combination. Well, the recommended starting dose is you start with just a little bit of the memantine and slowly build it up. The Aricept dose is the same, so it's always 10 milligrams, but the memantine dose goes from 7 milligrams to 14 milligrams to 21 milligrams to 28 milligrams. You do that on a weekly basis, and when you're stabilized, usually you're taking 1 pill a day, 28 milligrams of the memantine extended release, and 10 milligrams of the Aricept, or the donepezil. Now, some people can't swallow pills, so for those people, the pill can be opened, put a little bit of applesauce, and you swallow that down. It should not be chewed. It should not be crushed. People who have severe kidney disease should take a reduced dose, maximum 10 milligrams of the memantine. And if you have mild to moderate liver disease, you don't have to change the dose. Well, all drugs are associated with some kind of side effects. This too, of course. A significant number of people are going to have some problems with headache or with dizziness. The donepezil component tends to lead to diarrhea that can last for up to about 3 weeks, kills the appetite in a lot of people, causes some bruising or some nausea or some vomiting. And if the urine pH is elevated, that's going to increase the concentration of the memantine and might lead to more side effects. The urine pH is increased if you have a severe urinary tract infection, if you're taking some sodium bicarbonate, if you have certain other kind of medical diseases. And we know that the drug can interact with some of the anesthetic medicines used to calm the muscles, the muscle relaxants, like succinylcholine. We know that if you take these medicines, they can interfere with the heart transmission, the impulse going from the top chambers to the bottom chambers, so you could have a very slow heart rate and faint, especially if you happen to be taking a beta blocker at the same time, a medicine like metoprolol. It can cause some difficulty urinating because it can cause a bladder neck obstruction, cause seizures. And the donepezil can increase the stomach acid that might lead to a peptic ulcer, or might lead to more ulceration if you happen to be taking aspirin with it. And in some people who have asthma or people who have chronic obstructive lung disease, makes those conditions worse. Well, the memantine seems to be better tolerated than the donepezil. You have to be cautious when you take the donepezil because it's going to interact with certain of the medicines involved in this acetylcholine story. So for instance, you shouldn't take it with an antihistamine, the original kind of antihistamines, the Benadryl, diphenhydramine, or the chlortrimeton. You shouldn't take it for the medicines that are being increasingly prescribed for overactive bladder, and you shouldn't take it with a tricyclic antidepressant. Some of the side effects, if you happen to be taking the donepezil specifically, might be nausea and vomiting and anorexia, urinary incontinence, vivid dreams, decreased heart rate, You could faint, you could have insomnia, maybe fatigue and muscle cramps. And you don't take the NMDA inhibitor, the memantine component, if you're taking a medicine that's sometimes used for Parkinson's, like amantadine. But more importantly, there's this medicine called Nudexa that's being pushed for pseudobulbar affect. Shouldn't take that. And you shouldn't take dextromethorphan. That's Robitussin if you happen to have a cough. Well, a lot of people with Alzheimer's disease don't follow directions on their medicine, so they might take an overdose. Can an overdose cause some problems? Oh, you bet it can if you get too much of the memantine component. Well, that can cause some agitation or asthenia, can slow your heart rate, it can cause confusion or coma or dizziness or lethargy or stupor or psychosis or visual hallucinations and restlessness. And if you get too much of the donepezil, it can cause what we call a cholinergic crisis. That's sort of like the same thing you get, although not nearly as bad, as if you were exposed to sarin gas or if you were exposed to VX, the nerve agent. And some of the side effects might be salivation or vomiting or nausea or sweating or a decrease in your heart rate and your blood pressure, respiratory distress, coma. Major problem with these kind of medicines. So you ought to be able to get some benefit from the medicines if they have all those side effects. But we just discussed that the company says that there's no evidence that it's going to break the progression of the underlying disease of Alzheimer's disease. Well, the studies that have been done looked at patients who were taking the drug. And actually, they found very little difference between the people who were taking just plain donepezil or Aricept and the people who were taking the combination of the memantine extended release plus the Aricept. Now, they have a test, and it's called the Clinical Interview-Based Impression of Change. Originally, it was just for the doctor, but now it's been extended, and we have what's known as the CIBC Plus. And that includes the caretaker saying whether the caretaker thought the patient was getting better or not. And that looks at the general overall function and the ability to perform some of the activities of daily living and cognition and behavior. Then we have another one known as the Severe Impairment Battery, and it examines the cognitive function, the attention, the orientation, the language and memory, those sorts of things. So let's look at the change in the Severe Impairment Battery. If you take the drug versus you just take the Aricept or the donepezil, is there a big difference? On a scale of 100, there's less than a 3-point difference in people who take this particular drug. And as a matter of fact, the curves looking at the people who are taking just the Aricept versus the combination of the Aricept plus the Namenda, or the memantine, for the most part, they overlap. And if we look at the CIBC and we look at the difference between the people taking just the Aricept and the people taking the combination, it's only 0.3, 0.3 of 1 point. And as a matter of fact, 80% of the people taking either of the medicines showed minimal improvement, no improvement, or minimal worsening. About 10% of the people taking either the combination or the Aricept alone showed a little bit of improvement, moderate improvement. Marked improvement was in fewer than 5%. Fewer than 5% of the people taking Namzaric had marked improvement versus about 2% of the people just taking the Aricept or the donepezil. So basically not a very important, not a very significant difference. And if we look at the cost of taking Namzaric, the cost of Namzaric, cash price is about $15 a day, or $450, $460 a month. Now, you could get some of the generic Aricept, donepezil. You could get a month's supply for $10, the whole month, not just a day, but the whole month. And if you took the generic memantine, take 2 pills a day instead of one of the Namzaric. But if you take 2 of the memantine a day, that's going to cost you about $20 to $30. Now, on the other hand, if you go get the memantine that's sold as Namenda, that's the brand name, it's still going to cost you over $400 a month. Well, unfortunately, we find that there has been creep of these medicines, so that the majority of people who have mild dementia or mild to moderate dementia, the majority of the people getting the combination of these 2 drugs, even though there's no evidence that for mild disease that the combination does anything. And as a matter of fact, the International Journal of Geriatric Psychiatry looked at people who were taking the combination versus people who were taking the donepezil alone, and they said, no difference. And as a matter of fact, they did another study in Lancet Neurology just very recently. Again, no difference. New England Journal of Medicine, the combination versus donepezil alone. Again, no significant difference. The Scientific World Journal, again, no specific advantages of taking the combination. A French journal, Prescrire, well, they looked at the evidence and they said, we don't really see a whole lot of benefit. And in the Consultant Connection, recent edition, again, other than convenience, there's no reason to take the combination. And as a matter of fact, the Public Citizen Health Research Group, in their listing of the worst pills, worstpills.org, it lists memantine as a do not use pill. Now, there have been studies that show a little bit of benefit, studies that show no benefit, but there's been a lot of hanky-panky, a lot of lawsuits, a lot of maneuvering behind the scenes to get people, to steer people to one pill or another. A lot of dirty dealing in this business. So what's my take on the whole thing? My take is don't get your hopes up too much. You should avoid the complications. You should save your money. Likelihood of the pill providing any substantial benefit is extraordinarily limited, and you should remember what the company says. The company says, and I quote, there is no evidence that Namzaric prevents or slows the underlying disease process in Alzheimer's disease. Think about that. Anyway, thank you for watching. I'm Dr. Ken Landau.